I'm Mia Keys, as was mentioned, and I'm really excited to be here for a number of reasons. One, to be engaging with you, but then also, as was mentioned in my bio, I started through Kaiser, basically, in terms of health policy a good 11 years ago, straight out of college. I'm a Philly girl, so I moved to DC and came through the Kaiser Family Foundation as a Barbara Jordan Health Policy Scholar. And essentially, the program placed 10 of us, 10 postgraduates into offices on the Hill. So I was placed in Senator Tom Harkin's office, and that's how I got my start in health policy. It was a great time. It was 2008. It was right before Obama. He was running for president at the time. He hadn't even won yet. And the entire name of the game was health reform. And so that's really where I got my chops. And I have to say, she's not here right now, but I owe so very much in terms of my trajectory, in terms of the way I approach policy, and at the intersection of both academia and the actual political world, to Dr. Kara James. At the time, she was running the Barbara Jordan Health Policy Scholars Program right out of here at Kaiser. We often had all of our meetings here, literally right here. She would be here, and we would be there, and we'd be scribbling profusely, listening to her. So in her absence, I really want to give major credence and thanks, my gratitude to Dr. Kara James. So, yeah. Let's give her a hand, for sure. So I'm going to jump right in, and I want to make sure that I touch on some points that Dr. Ibe mentioned, but I want us to consider that this is going to be a reflective exercise, a reflexive talk. And so I'm mostly going to talk about policy and equity, but I want to also couch it in my own personal experience about how I see policies acting on my life, and I'm asking you all to do the same. Okay, so I wouldn't ask anything of you that I wouldn't do. So we're going to go ahead right into it. So I'm going to tell you a bit about myself. I told you I grew up in Philly. This is my little house in Philadelphia. My house does not look like this, but I'm actually very dexterous, but this is what PowerPoint allowed me to do. So grew up in Philly with a bunch of siblings and in a matriarch household, and let's just consider each of these rings about 5-block radii from my house, okay? So I went to school maybe about 10 blocks from my house, elementary school, and I was so excited after 6th grade I was allowed to walk to school. You know, you probably had those milestones as well when you were younger. You were able to finally do something that you weren't able to do the previous year, and as if a day seriously makes a major difference. But I certainly took advantage of that, and I would slow walk to school often just because I was always daydreaming and trying to catch up with friends. But that was a really big part of my coming into myself, being able to walk to school on my own. I was very athletic. I was a shy kid and super into my books, but I think what really helped me to get along with others and play well in the sandbox with so many different people. I was very athletic. I'm still super athletic. You can probably tell from my calves on my legs. People always tell me I have really great track legs, but it's because I played soccer a bunch and basketball and ran track and everything. Because I was so active athletically, I was always in the doctor's office, always breaking my hands or a finger, or certainly my glasses. I always broke my glasses. So I was in and out of the eye doctor, and we had an eye doctor not terribly far, about 8 blocks from our house, so we got to know them on a first name basis. And what else? So in addition to being able eventually to walk to school on my own, my mother entrusted my siblings and I to walk to Acme by ourselves and buy the weekly groceries, which of course we made an adventure in and of itself. It would take us a good 2 hours to go shopping for bread and eggs and all of that. But it was great. We didn't do a lot of eating out when we were younger. I think a lot of that was financial. My mother's a single mother, and she had a bunch of really very ravenous kids to feed. But from time to time, we would find all sorts of change in the couch, and we would go to Burger King. And I'll never forget this. My 2 of my younger siblings, I used to always cart them because I couldn't keep them by themselves. You know, you had to take them with you. We used to take the change and go in the morning sometimes to Burger King, and we would split a breakfast sandwich 3 ways. You know, so I don't personally eat fast food any longer, but I do become nostalgic whenever I see Burger King. Yeah, you do too. And then also, we grew up in a pretty religious household. My family we're mixed religiosity, but my mother is Baptist, and so we were in church at least 2 to 3 times a week. And church was actually maybe about 20 blocks from where we were. So it was quite a drive. We couldn't walk there. So why did I tell you this about myself? Because I want you to tell me something more about you. So what I would like for you to do, please, is draw a nice little house in the center of your papers. And I want you to draw about 5 or 6 rings around this paper. And what I want you to do is really just identify off the top of your head, what was your neighborhood like growing up? Okay? And you can take cues from what it is that I told you about myself in terms of where I went to school in relation to where I lived, you know, how I spent my extracurricular time, with whom, that kind of thing. Okay? And I'm going to just give us about 2.5 minutes to do this. Don't mind me. I'm going to walk around and kind of take a look. Okay? All right. Okay, I'll do you like some of my teachers did when I was growing up, pencils down. Do people use pencils anymore? But pens down, yeah. Okay, so we're going to get back to this. I think we're going to have time for discussion later, and maybe a lot of this will come up in discussion, but I will at least call on one person if you wish to share, and just let us know where you grew up, what kind of things you grew up around, what really impacted your life in ways that maybe you don't always give thought to. So I'll just take one volunteer, and then we'll move on with the slides. Anybody want to raise your hand or just jump right on in? Yes, please. And can you please tell me your name?
Melissa Potter.
Melissa, would you mind standing?
Sure.
Thanks.
Okay, so I grew up in a suburb in California, and at that time, a lot of where school, doctors, all of that was centered around where my parents worked. So we moved from a big metropolitan city, Los Angeles, to wine country. There was nothing in wine country. So school, work, all of that was about 45 minutes away. So I spent, I guess, preschool through 9th grade, about 45 minutes away from most things that we did.
Wow. Thank you, Melissa, for sharing that. I want to pick up on a lot of what you said. First and foremost, I just came back from wine country yesterday, and Napa for my birthday, actually. Yeah. Yay. Thank you. Yes, June babies rock. We sure do. But you mentioned, and you as well? Okay, there. What's that? Yeah, all right, then, yes. So you mentioned a couple things. So you talked about a move with family, a lot of where you lived was further away from the things that you needed, that kind of thing. Was that apparent to you as a child?
Yes, I guess I would say yes, because when we lived in Los Angeles, I was very small, but my preschool at the time was, we could walk there.
Mm-hmm.
Versus taking a long car ride, which I didn't mind, but, I guess, yeah.
Mm-hmm.
It wasn't right.
Okay, so the idea of distance, the idea of time, movement, all of that. As children, sometimes those things can feel very loose. They feel nebulous. They're not real concepts until maybe we're older. But let's just hold on to those things. Mostly I bring them up because when we think about, to bring it back to the context of public health, when we think about what it means to be healthy, when we think about what it means to grow up in a context that really either contributes to your wellness or takes away from your wellness. We all in this room can talk about social determinants of health. We can all talk about the fact that what we do is a lot less, I don't want to say it's a lot less significant, but we don't always put the significance on what is almost done around us, what is almost done to us in a lot of ways, right? So the fact that health is a lot more, according to WHO, than individual behaviors, right? And being able to access things that make us healthy have a lot more to do with where we live, where we play, what we have access to in terms of getting to where we need to go. And when we think about that, we tend to think about it in a theoretical sense. We tend to think about it in a scientific sense, as we should. But how often do we individualize it? How often do we evaluate and do really do a large sweep of our lives and think about, okay, every second of my existence in this world has either contributed to my health or it's taken away from it in terms of what I've been exposed to, right? So that's essentially why I wanted you to do that exercise, and I want you to keep that in mind as we continue to move forward and talk about what it means to be healthy and in terms of policies and certainly in terms of science. But to get back to the policy part. So you all know about this, different social determinants of health, your housing, your education, access to doctors and such like that, as Melissa mentioned. Any hazards, environmental hazards that may have been, maybe some of you drew coming from Philly, there were water towers and power plants near the highway, not terribly far from where I live, but not super, super close. But I knew they were there because every time I drove by, they stunk to high hell. And I was just like, I used to blame my brother for, smelling like that. But, racism and discrimination, that long-term stress, that matters. And maybe we don't always think about it as children, but I bet you there was a moment in your lives where you felt a tinge of discrimination, whether it had to do with your race, your religiosity, your gender, your sexual identity, whatever. And those are moments that stick with us no matter what, right? Exposure to violence, all those things. Poverty, for sure. We were not the richest of people. I was very fortunate in that I didn't always feel that effect, but I think that's just because my mother and my father were just very creative about that. But anyhow, when we're talking about addressing health disparities in the policy sense, it's really important, especially whenever you talk to political leaders, whenever you talk to policymakers, that you give them the stories, right? And maybe sometimes it's starting with your own stories, or maybe it's starting with stories of others, because those stories really matter, those anecdotes matter, and then you have to back them up with the science. You have to give them the numbers, but really start with the numbers, with the stories, because policymakers forget that they are people too sometimes, and we forget that we are people, and sometimes we are really so very driven by the fact that we're representing others that we forget to insert ourselves in the story of policy. So I do want to walk through some stories, but I want you to imagine yourselves in these spaces. So this is me and two of my siblings. That's my little brother there in the corner. I keep saying little brother, but he's 30 with 5 kids. He's not little any longer. And that's my sister there. She's actually about to have a baby any moment now, which is why I have my phone close to me, just in case her husband calls me. But where you get your fruits and vegetables, if you have access to, we walked to Acme, so that was fortunate for us. But maybe you didn't grow up in a space where you could walk to get your groceries. A lot of my cousins went to corner stores for their groceries, and they didn't sell anything but battered apples and bags of chips, right? And maybe you felt you had something similar. Maybe you grew up on a farm, but really couch yourself in this background. See yourself in that picture, put yourself in that backdrop, and think about, where did I get my food when I was younger, okay? How about where I played? Like I told you, I grew up in Philly. If you know anything about West Philly, I grew up in Southwest Philly, and my family's from West Philly. If you know anything about West Philly, the playgrounds are not for the children, necessarily. They're doing a lot now through the city to change that, but Malcolm X Park, you would think with such a really distinguished name, it would be a place where people would feel empowered. When I was growing up, we knew not to go there after dark. How about where you accessed your care? As I mentioned before, I was always breaking my hands and my fingers. I was fortunate that we had a hospital not terribly far, and we were covered in insurance. So I never thought about it. I just went and always had care. But I knew that was not the thing for everybody. And eventually what I started to think about was, okay, how did these decisions come to be made? There was someone or something that was put into place that determined how eventually my life trajectory would work out, and your life trajectory would work out. And it's not necessarily one person saying, I condemn thee to a world of poverty, I condemn thee to sidewalkless streets and having to drive everywhere. No, these are a result of policies over time that have impacted our health. And they could be couched in health policy themselves, or they could be something completely different, but have a serious impact on our health. And so what I would like to do moving forward is just walk through historically what policies have looked like in our country over time, and how today they impact our health and our well-being. So let's just go ahead and walk through some of these health policy milestones. And I'm going to start in the early 19th century and talk about the Indian Removal Act. How many of you have heard of the Indian Removal Act before? Okay, so I see a good number of hands, and I'm so glad to see that, because unfortunately sometimes when I go into different places, and a lot of people aren't aware of this. So Indian Removal Act, back in the 1830s, you had at the time Andrew Jackson, who would eventually become president, essentially said, well, we're going to take all these lands from the Cherokee Nation, and Cherokee Nation, of course, makes up so many different groups of First Peoples, but mostly couched in the south of what's now the U.S., right? So the Mississippis, the Alabamas, the Georgias, that whole area. And we're going to take these lands, and we are going to tell everybody to go. They have to go. And if they're not going to go because there was fighting, they're not going to go, they're going to die. Right? So those lands were taken, and then about 30 years later or so, those same lands were conferred to new white settlers, mostly from Ireland and from areas like that. And essentially, and there were many iterations of the Homestead Act, right? And so when we're talking about and we're going to jump back and forth in time, but the reason why these two pieces of legislation are significant, these policies are significant, is for one, of course, when you're talking about health of First Peoples today, when you're looking at health outcomes such as maternal wellness, when you're looking at hypertension, when you're looking at chronic diseases and such like that, consistently, Native Americans are experiencing the worst outcomes, and that is across the board, right? And it's very hard for people to then say, well, maybe they need to stop eating the foods that they're eating. Maybe they need to work out more. It's easy to say that, but we've already established that individual health behaviors have very little to do, have very little power up against generations of loss of right to lands, right to foods to grow, and things like that. And of course, with the Homestead Act, if you're talking about generational wealth built through land ownership and home equity built into homes and wealth and such like that, you can't talk about that if you're not referring back to what was done years and years and years ago. Which, and this is somewhat of an aside, and I hope I don't offend anybody by saying this, but this is why I'm a little irritated by what has recent leaders in the Senate have said about what reparations should and shouldn't look like. But that's a whole nother conversation. Yes. Right, so we can fast forward to 1865, and of course the Civil War. Now I'm still thinking about those comments. The Civil War ends at this point, and then we go on, and we have a period of Reconstruction, and black men are essentially given the vote. And with the vote, of course, comes representation in Congress and distribution of resources and things like that. That's always terribly important when we're talking about what everything looks like now. We already talked about Reconstruction. World War I, you see a lot of people now, especially in the southern countries, moving to the north, right? You have a major migration of especially now black Americans, well, at least men at this point are counted, moving to the north and coming into industrial jobs. They're coming into better ways of life. And a lot of people are essentially gleaning their wealth or their a better start through enlisting in the war. Right, and then the New Deal hits us in '34 under Roosevelt. So with the New Deal, we also have the Federal Housing Administration. And I can go on and on and on about what the Federal Housing Administration essentially did with right to ownership to lands and houses, of course. But of course, you have to talk about redlining, and you have to talk about the establishing states of segregation and what that looks like today in current cities, right? So when you're looking at discrimination, when you're looking at people who I think you were talking about Remington being Rembrandt. What is it? It is Remington. Okay, I just made up a whole nother name for the neighborhood. I have to get there. But being completely gentrified, right, of course, but this historically had been a black neighborhood. Remington was?
No, actually it was mostly predominantly white.
It was predominantly white.
But low income white.
Low income white. Well, still, a lot of those people were cut out of, I'm sure, being able to access more affluent areas for whatever reason. Right, but you can see that in so many different neighborhoods now, certainly in my hometown of Philadelphia. Moving on to the Social Security Act, and we're going to breeze through some of these because most of you already know all this stuff, but I want you to think about how it has impacted your life and the lives of those who you represent. I have 2 minutes to run through this. Okay, Social Security Act. Basically, this was guaranteed income for people who were elderly, but it didn't apply at all to domestic workers or to agricultural workers. Who historically in our country is domestic worker and agricultural worker? Black and brown people, consistently. And that's still the case to the day, right? Now, a lot of people will argue that that was such the case because of tax, the way the tax structure went, but whatever. World War II, again, so I know I had relatives who fought in World War II, and we'll say all that we have to say about the wars. I will go into more of that if I had time, but I do want to kind of breeze past through this and talk about Civil Rights Act 64 and also talk about Voting Rights Act and Medicaid and Medicare. It's so fitting that we're here in Kaiser because Kaiser, if you haven't seen, they have a fantastic video about the history of Medicare and Medicaid if you just go to their website and take a look. But the significance of Medicare and Medicaid was not just that access to care was expanded, but for hospitals and such to take advantage of that, they had to, and health centers to take advantage of Medicare and Medicaid, they had to desegregate their gates. They had to essentially say, okay, yes, federal government, we would like your money, but and then the government's like, oh, okay, if you want that, you have to now open up your halls and your emergency rooms and such to non-whites. And that's essentially why we start to see behavior changes in terms of how hospitals and clinics and such like that are able to admit and also treat people of color. It's not because there was a moral epiphany. It was because there was policy put in place that drove behavior change, right? So please keep that in mind. All right, Immigration Reform Control Act, 1986. This may or may not have been the year I was born, but I personally think that so much happened in this time frame. This was essentially, this I think we tend to skip over because so many of us don't necessarily give as deep, a lot of us do, but so many people on the large scale don't give as much thought to what immigration reform means and why we have to be really thoughtful about where our country has come from and how we have to do a lot better with respect to how we treat persons who are trying to get into the country. And I can go on for days and days about that, but I will move on here. Americans with Disabilities Act, I told you when I first came through Kaiser and they placed me in Tom Harkin's office. If you know anything about Senator Harkin, who was in the Senate for over 20 years, he established the ADA. He's the reason through his policy that now all public buildings have to have accessible entryways and such like that. So we have a lot to say about the significance of policy on the lives of differently able-bodied persons and how we're able to interact with people irrespective of the way that they present because of this law. Welfare Reform Act in the Clinton administration, this essentially ended TANF, the temporary assistance to needy families. And with TANF, you also, well, with the ending of TANF, you also then started to see in years after just a surge of unemployment, especially amongst women who were matriarchs of their families and such like that. I can go on and on again about that. But let's just fast forward to the 21st century with the ACA. Under the ACA now, again, you see, similar to 1965, a complete expansion of access to care, but not just access to care, but also emphasis on protecting those who have come into spaces with previous conditions, who are coming and saying to themselves, I've never had access to care, but now I want to be more healthy, I want to be proactive, now I have the ability to do so, right? One thing I really love about the ACA, and I have to say it's not perfect, it's not perfect, it's not perfect, and we have a lot to do in terms of building on our current health system, but the fact that we're able to take advantage now of services that were not previously available to disparate populations and so forth, that means a lot, and it will mean a lot 100 years from now where none of us are here. And maybe somebody else is doing something similar and starting at 2010 and saying this is where we need to look at the policies and this is when something started in terms of making things a lot more equitable for health outcomes in our nation. Individual mandates repealed just 2 years ago, and essentially I'm wondering where are we going moving forward in the future. So I'm going to actually stop here. There was one more slide, but I do want to stop here and basically say, when we're thinking about equity, when we're thinking about policy, I want you to first and foremost start within yourself and think about where you've been across your lifespan, where you're going, and how a lot of that is probably predetermined by what's happened before you, and a lot of it will be determined only in so much as the policies that you represent or the policies that you drive will bring everybody along in an equitable sense, right? But understand that because of who you are, because of where you've come from, you may fall differently on that line of privilege. Certain policies work better for others than they do for you and vice versa, right? So never forget that point. Never forget the fact that policies do matter, and they matter because they've mattered for a long time before you, and any policy that you're representing, it's a terrible policy if all it does is handle what's happening today. You have to think about it in terms of using the research to drive it forward, in terms of trying to consider what will happen 100, 200, 300 years as a result of that policy. So I'm going to stop there. Thank you so much for your attention. I hope we can talk about what you drew in the discussion.